Hi, welcome to Breastfeeding with Sarah. I'm Sarah, your lactation consultant. In this video, we'll be talking about osteopathic manipulative treatment as a way to resolve underlying barriers affecting breastfeeding involving infant suck dysfunction. Babies can be born with pulled neck muscles or pinched cranial nerves from the pregnancy and birth process that impact their ability to latch or move their tongues in a coordinated way. So sometimes the results can be a baby who cannot latch, or a painful latch, or a baby who cannot transfer full feedings at the breast, so they have poor weight gain. Are you wondering why your baby is struggling with these challenges and all your other efforts to resolve the problem isn't working? We'll learn how these conditions for breastfed babies can be identified and treated with osteopathic manipulative treatment, often referred to as OMT, and see a real OMT treatment in action. We'll also hear from an osteopathic physician and see pictures and videos of me doing newborn assessments with the Breastfeeding with Sarah community. Come join us. Look at what's happening with your baby's head. A fetus's skull is divided into 5 separate skull plates, and the cranial nerves come out between these skull plates. There are cranial nerves coming out, connecting to the jaw and to the base of the tongue. And so if a baby is in an occiput posterior position, that is the back of the baby's head against the tailbone, when a woman's in labor, the force of childbirth will push the baby's head or the occiput into the tailbone, and that can compress cranial nerves in the back of the baby's head and cause a suck dysfunction or uncoordinated suck. So if a woman had back labor or the baby was occiput posterior or OP in labor, that can cause a suck dysfunction and have the baby have challenges with the latch afterwards. Also, if there was a vacuum delivery, it could compress cranial nerves, or if there was if the baby was asynclitic or in a position in labor where the baby was stuck against the pelvis for an extended period of time, or if there was many hours of pushing, or if she actually gives birth rapidly and the baby is pushed out very quickly, that could actually compress cranial nerves as well, causing a very tight latch. So I found if babies are born very fast, they have a tight latch, compressing the nerves that go to their jaw and having their jaw be really tight and an excessively strong suck. Baby could also have been wedged, so their neck is crooked or tilted in the uterus, and that could cause them to have torticollis or a twisted neck. And when they come out, their neck is twisted and doesn't seem to want to stay to go to the other side. So a twisted neck or torticollis could cause it difficulty for the baby being able to turn their head the other way in order to latch. So oftentimes that manifests as the baby latching okay on one breast, but when you try to turn them over to the other side, the baby doesn't latch on as well, has a lot of difficulty getting onto the breast, or is actually not able to latch on that breast, or it's a very painful latch. So if it's a painful latch on one breast and not the other, that's a sign there could be some compressed cranial nerves or pinched nerves in the neck and muscles in the neck that make it so it's hard for the baby to latch. To start with assessing the need for osteopathic treatment for your baby, always begin with reviewing the birth story. Was the baby breech in utero? Was the baby wedged into a tight position because of size or a uterine abnormality? How long was the labor? Was there back labor? How long was the pushing phase? Was there a shoulder dystocia or a vacuum-assisted delivery? Any of these factors could have compressed baby's cranial nerves or pulled neck muscles or the hyoid bone, all of which could impact baby's ability to latch and transfer milk and could cause a suck dysfunction. Signs and symptoms of a suck dysfunction include a weak suck or low oral tone, inability of infant to maintain a seal at the breast, milk dribbling out of baby's mouth when feeding, feedings that take longer than 40 minutes to complete, baby not transferring full feedings at the breast, insufficient weight gain for infant, baby with an excessively strong suck, baby tongue thrusting, a painful latch on both sides or on one side only, compressed or blanched nipples after feeding or nipple damage, baby biting or chomping when feeding, baby preferring to nurse on one breast over the other, baby's jaw quivering during or right after feedings, baby gagging with a deep latch, baby pulling back from a deep latch to a shallow latch. Some of these signs and symptoms could also be due to a tongue tie. Suck dysfunction and tongue ties are often difficult to differentiate and require a skilled lactation professional to determine what the cause is, and sometimes both are the cause. Always make sure you are getting the basic principles of latching done well so the latch is deep and effective and you have fixed any issues with your latching technique as the cause of the latching issues before you look for a suck dysfunction. See the comprehensive video I made about this called How to Latch Your Baby. Here I am at a home visit with a 1-week-old baby. This baby was born with a very short and rapid pushing phase and has been feeding well overall and gaining weight, but the latch is feeling tight and pinchy for mom, and there is more difficulty latching onto one side than the other. I'll be doing an osteopathic assessment on this baby to see what I can identify on exam. And look and see, are they symmetrical? Is there any asymmetry or tension? I see a lot of tension with his right shoulder lifting up. But then we just kind of keep observing and see how does he move with that. Yeah, to be his shoulder hitched up, his right shoulder hitched up. Yeah. And then I look at his face and his ears. Sometimes their earlobes get curved up when they've been tucking their head over to that shoulder a lot, but I don't see that with him. Okay, my friend, may I take a feel in your mouth? Is that all right? So what I do is I take a feel and feel their tension in their jaw and their coordination of their tongue with the suckle. And I feel his gums biting down quite a bit. And I feel the tongue thrusting. Yep. I can feel that. Yeah. And what I like to do after they suckle for a little while and I feel the movement of their tongue, he does seem kind of gaggy, like he gags when there's that contact on his palate. That makes sense why he latches on and pulls back. And that's an osteopathic indication. Feel his suckle and see if his suckle changes when he's has his head over his right shoulder. Yeah, he really loses the seal when I turn it over to left shoulder. He loses the seal. It's much tighter on him. Huh. Yeah.
That's really interesting.
So usually when babies are hitched up to one side, they're favoring that. And so they do a little bit better with their coordination when they're on that side over towards his right shoulder. And then what we do is have him continue to suckle and orient his head over to the non-favored side and see how that made him tense up a little bit. And
hi baby, good job.
And so he's not showing as much coordination with his head over his left shoulder. There we go. A lot more tension, and he's having to grip. He's having to grip and more tension with his head over his left shoulder while he's suckling, showing that there might be a little bit of deviation maybe in his hyoid bone or in his neck muscles.
Where's the hyoid bone? Oh,
hyoid bone is right in your throat, so free floating one, and that is an area that the osteopaths work on very closely because it connects to the base of the tongue. All the suck muscles are connected to the hyoid bone. Yeah. And that's kind of connected to the shoulders, and so when he's hitching up on one shoulder, it could have an effect, show that there's an effect with the hyoid bone. Yeah, and I'm just noticing if he's quivering at all and fatiguing from having his head over his left shoulder. He's definitely showing a lot more tension with his head over his left shoulder. And then bring it back here. I know. So he just really notices a change to the midline. And bring his head over to his right shoulder. He might be a little more comfortable there. So he does, in general, have an excessively strong suck, which is showing some tension from coming out so quickly, pinching those nerves. And he does have a right-sided head orientation, and his right shoulder's hitched up, so I think some body work is just going to be so helpful for him to loosen up those restrictions. And again, not that there's something wrong, it's a lot of work to be born. And just being in utero, in the end, can make their head be deviated to one side, being wedged in the pelvis.
He was tilting this way for a while. And she had to like engage his head in the right position that morning. Because he's still kind of sideways.
Yeah, so that's his preference, is going over there. And he just complained when I started moving his head to suckle over the other side. He's saying that's hard. It's hard on his neck. So what we want to do with nursing is support him in the position that he's favoring until he gets the body work.
Oh, okay.
So just being mindful of those positionings at the breast. Okay, my friend, you did so good. And I'm going to check for a tongue tie. Okay, no tongue tie at all.
Okay.
Yay. Yay. Okay, thank you, my friend. I've interviewed an osteopathic physician who works with breastfed babies to tell us what they do and what the OMT treatments involve. Then we'll see an OMT treatment in action with the baby and see how effectively they help resolve the baby's breastfeeding issue.
So osteopathic medicine is a form of Western or conventional medicine that stands in parallel to allopathic medicine. So osteopathic physicians earn the DO degree, whereas allopathic physicians earn the MD degree. Additionally, we learn a hands-on form of diagnosis and treatment called Osteopathic Manipulative Treatment, or OMT for short. It's a way essentially to look for restrictions, lack of motion, asymmetries in the body, and work with those to try to optimize the structure of the body so that its function can flourish. So it's a way of working with anatomy to support physiology. When we do find restrictions in babies, often the way that clinically manifests will be in feeding difficulties. A lot of the compressive forces of childbirth end up creating restrictions around the head and neck, which is where all of the nerves come out of the brain that are responsible for feeding and sucking and swallowing and digestion. And so often one of the clinical manifestations will be tight latch or difficulty with the coordination of sucking and swallowing. We can work with digestive issues a lot, so later on the babies that are labeled as colicky, sometimes that's just an expression of some restriction in their bodies. I would say second to that, we work with see a lot of torticollis or plagiocephaly start to become expressed. That often do originate from things that happened related to the birth process. Osteopathic manipulative treatment is really gentle, and so what it ends up looking like, I always do a head-to-toe assessment of the baby, and for those who are having latching and feeding issues, spend a lot of time on that the head and neck area. So often it looks like cradling the head and neck, sort of wrapping fingers around the head to feel the different cranial bones and feel their shape and their intrinsic movement or lack thereof, and looking for areas that are of compression. We also focus a lot on the sacrum. There's a direct connection between the head and the sacrum bone down in the pelvis. And then the diaphragm we end up working with a lot. So it looks like a lot of holding, some gentle movements.
This is a 1-month-old baby whose birth history is that it was a long, difficult labor, and they were a large birth weight baby who was persistently OP, or occiput posterior, in labor, causing back labor for mom and compression of the nerves in the back of the baby's head, which resulted in a very uncoordinated suck with breastfeeding. The mother had a painful latch from the beginning, and baby was not able to transfer full feedings by the end of their first week of life. Baby only transferred a fraction of the milk she needed for her feedings at the breast, despite mom having a full milk supply and getting extensive lactation support with the latch. This mother had to pump and supplement her breast milk back to baby after every feeding in order for her to get enough milk to gain weight well. See what a tight latch baby has at the breast? The creases around her lips show how much she is gripping onto the breast with her lips because her tongue is not able to move in a coordinated way. This baby did not have a tongue tie. See how chompy and uncoordinated baby's suckling movements are? This is ineffective suckling and ineffective milk transfer, verified by weighted feeds. This baby is coming in for an OMT treatment with an osteopathic physician who will be working on the areas of compression in the baby's skull, sacrum, and hyoid bone.
Fatiguing because if you're tight in those strap muscles, it's working against that. That's unnecessary.
See how baby is now gulping with every suckle? This was a dramatic shift in baby's coordination and ability to transfer milk directly at the breast. Her ability to coordinate her suckle shifted during this OMT treatment. This baby was weighed before and after this feeding and was shown to have transferred a full feeding at the breast for the first time ever. After this treatment, mom was able to stop pumping and supplementing, and baby was able to transition to full exclusive feedings at the breast. The nipple pain was also resolved from the OMT treatment.
For me, it is the combination of lactation support and osteopathic treatment. To me, that is the standard of care, and so I definitely dream of having that be sort of the default of what we are able to offer people and what people can expect and ask for themselves.
So as you can see, OMT treatments are very gentle and can be an effective way to resolve underlying suck dysfunction and get babies back to breastfeeding well. Follow the links below to find a lactation consultant in your area and also osteopathic physicians in your area or other bodywork practitioners like craniosacral therapists, physical therapists, or chiropractors. Please subscribe to this channel to get notifications for more videos that are going to be coming out that are going to help support breastfeeding. And please share this video with someone who you think could use the information.